Let's get to our first article. And this one is, I think, right up your alley, doctor, as an addiction specialist. In this article, it says that substance abuse is actually correlated to mental health. And roughly about 50% of individuals with severe mental disorders are affected by substance abuse. So I think the question is, what is this link between substance abuse and mental illness? Is it when you abuse substances, it can cause mental illness, or is it the other way around?
Yeah.
So usually this combination of substance use and mental illness is termed as dual diagnosis in psychiatry, and it's a subspecialty of its own. So we have addictions psychiatry, and then under addiction psychiatry, you also have dual diagnosis, where we deal with people with a substance use problem and a mental health problem. And the reason is because it's actually more complex, it's more challenging, and it's so common to have that combination of substance use and mental illness. It can be one or the other. It can be a mental illness that's causing the substance use to, be increased, or it can be substance use that causes a mental illness. But that's why typically in a lot of countries, addiction specialists have a psychiatry background. So in Australia, for example, most addiction specialists are not psychiatrists. And so then they have a challenge in trying to deal with the psychiatric comorbidity of a person that has a substance use problem, because it's so common and you need to treat both at the same time as well. But yeah, typically a substance use can worsen mental health symptoms. So somebody, for example, with depression who consumes alcohol can, when intoxicated, become very suicidal. And then the substance can also interfere with the treatment, with the medication or therapy. And so people don't see resolution of their mental health problem due to, just concomitant use of the substance as well.
Okay, so is there a way that we can sort of break this cycle?
Well, again, it's first understanding it's a chicken and egg story. Which came first, right?
Yeah.
So it's important to be able to do a good assessment to understand, their background, maybe their family history, and, triggers for their illness or their substance use, and then identify, the type of substance and the effects of these substances as well. Usually we use an integrated approach in helping these people, and that's usually coordinated by a mental health professional. And typically we start with detox. So the substance has to be, sort of removed, and, the person has to go through a detoxification of, coming off the substance, and then being completely substance free for at least a month before deciding, is this a mental illness underlying? Because substances can cause symptoms of a mental illness. I mean, substances that are depressants, for example, like opioids or alcohol or benzodiazepines, they cause depression in people. And then substances that are stimulants, like cocaine or amphetamine, they cause manic-like symptoms. Or those hallucinogens cause psychosis. Now, when they come off the body and they've been abstinent for a month, if it still persists, then yes, there is an underlying mental illness. If it's gone, then it's most likely due to the substance.
Statistically, which one is more like the one that's caused by substances that causes the mental illness, or the one that's mental illness causes them to go to substances statistically? Is there a number for this?
Well, generally about 50% of people who use a substance have a mental health problem, but about 30% of people with a mental illness will have a substance use disorder as well.
So it's more likely caused by the substance abuse.
Yeah.
Is that easier to treat though? Then I mean,
no, so that's why it's actually a challenging field, and trying to get them. First of all, you need to get them to think about wanting to stop the substance. So motivating them to make a change. When they stop the substance, then we can address their underlying mental health problem.
Whether or not they have it, right? Yeah, because sometimes after they detox off the substance, they become normal again.
They become normal, exactly.
Yeah.
Okay.
Yep.
It's like Bel and Durians.
Which came first, you mean?
So what? Do I have to detox myself off durians? Is it? Not like you can smell me right now.
You don't have a mental illness due to it, right?
Anybody who loves durians in my book are mental slightly. I don't
Horrible, are you? Just like how
Once you
Dr.
like
Phil
Man
would think
United,
that
then you-
anyone
then
who
you
loves
hate durians.
Manchester United has a
Exactly.
mental
Oh,
issue.
wow, both of you. Wow,
completely
wow.
agree. Take it from the psychiatrist, you're absolutely right.
Wow.
Okay. All right, let's move on to our next article. This one's pretty interesting. It talks about this therapy that I have read of, but I'm not sure whether we use it here in Malaysia. It's called music therapy in the treatment of mental illness and the enhancement of societal well-being. Now, doctor, have you ever heard of music therapy? Do we use it here in Malaysia?
Yeah, actually, music therapy is something that is common. Very often, music therapy is an adjuvant.
What do you mean by that?
Adjuvant is typically added together
Oh, okay.
or like a complementary treatment.
Mm.
So somebody with depression, you want to treat them with maybe medication and therapy, but you can add on music therapy. So it's an adjuvant. It helps in the process of recovery. For some conditions, it's actually sometimes a little therapeutic as well. For example, autism spectrum diseases. Some children find that they can, they find modulating of their emotions and mood with music. Music therapy is nothing new in Malaysia. There's actually a Malaysian Music Therapy Association comprising of qualified music therapists. I know a music therapist myself personally, and she's worked with several different groups of people. It's not only for mental health problems, but also for physical problems. So people even with, for example, recovering from stroke, find that music therapy together with their physiotherapy and other therapies actually help in that whole process as well.
Interesting. But is it as simple as just like listening to music to treat the illness?
Not really. It's actually more complex than that. Now, I'm not an expert in this, but basically the gist of it is it focuses on 5 main things. One is attention, and that's basically to help distract from negative stimuli. And then the second is emotion regulation. So that is, where music can actually sort of activate certain parts of the brain to help with regulating moods. And then cognitive modulation. There's certain types of music that actually can help with memory processes. For example, the what do you call Philharmonic Orchestra, or the
I've heard of this
music.
Baroque music. It helps you to remember stuff. I think classical music and stuff.
Yeah.
That may be a little different from what's evidenced in the research.
Really?
But
Right.
yeah, but again, it actually depends on the individual.
Mm.
So you can't sort of introduce something completely new and expect that person to have a benefit. It actually depends on the baseline of the individual. But there are other measures as well. There's also a way of communication. So music can be a way of communication. So it can be a non-verbal form, which is often used for autism spectrum disorder as well. And then this behavior modification to affect, how people speak and walk and talk as well.
Mm. Wow, didn't know music can help with so many things. But is there a specific kind of music that's used for therapy, or it's like a wide range of music, like music we play on LITE as well?
Is it a
Can it be
beat?
used
Is
for
it-
therapy,
yeah.
or is it only like beats? Because I remember listening something like reading something about this thing called binaural beats. Is it? It's supposed to
Yeah.
help with your brain waves somehow.
Yeah, so there are actually various types of music. I mean, there's some studies that actually show it's dependent usually on the individual's preference. But there's also, 2 different types of therapy. There's receptive and then there's active. And in the active, people may be participating, actually engaging in producing beats. So you can have drums, you can have hand percussion instruments, you can even sing. So some songs have actually been reported to allay anxiety, and I think some of them are the ones that you play on LITE, like "What a Wonderful World" by Nat King Cole and Sailing by Christopher Cross. I mean, these have actually been identified as, across the board, trying to and cope and allay anxiety.
Right.
Okay.
So is that why, like, when I go to, let's say, a massage, they play like all this really chill music, but sometimes when I hear chanting, like if I hear some prayers that's chanted, it gets your mind in a different mental state. Is that why?
Yeah, absolutely. So different experiences. I mean, it also depends on experiences in childhood. So childhood experiences, can have a subliminal sort of influence on what you experience and hear as an adult. And, so there are some people who respond, with a lot of positivity when they hear things like chanting music, but there may be others who find that another type of music suits them more.
Yeah.
Is that opposite to this? Some music makes you, like, affects
Angry.
you negatively?
Heavy metal.
No.
Does it make you angry?
Again, it's all an individual's preference.
Okay.
So, if you've not been exposed or, used to heavy metal or, rock music, and you're now exposed to it, you might actually find that you feel more agitated or, unsettled with that. But for those who are comfortable with it, then it actually may aid them to feel more comforted.
Yeah. Oh, it's like me. Like, every time I hear the song Lemon Tree, it agitates me.
I've forgotten about that song until you mentioned it earlier.
I don't like that song either.
Yeah.
Okay, let's get to our next article. This one is about professional athletes who are experiencing a rise in mental health issues during lockdown. And there was another article in the Star speaking about how football players, like professional football players, have an increased risk of mental health problems. So, I mean, one would think that professional athletes are the fittest, not only physically, but mentally as well. So why is it that this lockdown is so hard, specifically on professional athletes?
Well, sometimes when we tune ourselves to be strong and, able to cope with things, it's for certain specific events and things in our life. Everything else is blocked out. And then when that changes, that can actually challenge us to, change how we think and feel about certain things. I mean, a recent survey of professional footballers found doubling of depression rates. And it's actually worse in female athletes compared to in male athletes. Well, one of the factors is, of course, when we exercise, we actually stimulate our reward pathway. And, that when that becomes regular and heavy, it's almost like a drug. We need it to actually feel normal. And when we're not exposed to experiencing it anymore, then we get this, sort of withdrawals from the whole effect. So it can cause dysphoria, anxiety, and a lot of other negative feelings. Why females more affected more than males? Well, it can be because the athletic career is very different from in males. It's a lot shorter, because then they go on to, other pursuits in their life. And so for them, they may see this as a big, sort of disruption in their whole opportunity in their whole career as well. I think it's also related to, team sports. And when you have team spirit and you build a relationship that is so cohesive and so strong, and we don't have that opportunity to work with a team. So although you may be training and, working out in your home, but when you don't meet the others, then you lose something that has actually helped in your whole reward system as well.
Camaraderie, you're right.
Yeah, so that's why they're taking it so hard, because they are so used to pushing themselves to the limit. Now that they cannot work out as much and they cannot compete, I think the competitiveness in them as well, right, has to be.
Yeah, absolutely. So competitiveness also increases the stimulation of your reward pathway. Now, if you don't have any competition to participate in, then that's actually going to lead to this whole withdrawal effect as well. And that whole negativity and feelings and emotions as well.
So is there any way that these high-performing athletes can overcome this issue? Is there a solution?
Yeah, so I think the important thing is that first understanding that, maybe their whole purpose and their career is focused on their sport. And when it's removed, it can affect their self-esteem. So it's important that they maintain training and work on a strict schedule, incorporating healthy diet and adequate sleep, but also now pursue new pursuits. They have more time on their hands. They're not going to be traveling and working with others and everything else, and they can start perhaps a new online course, engage in more family activity, or do that hobby or activity that they've put in the back benches for a long time. They need to stay connected with their peers and their coach, and I think the important thing is to shed stigma, because just like you started off saying, they're the strongest, they're the fittest, but it doesn't mean that they're immune to develop depression and anxiety. And they need to be able to seek help when they need it.
Well said. Well said.
Actually, a lot of in football leagues, what they're doing now, football, and also I know motor racing, what they're doing now is getting them involved in all this e-gaming, e-racing, and all these football leagues. I was just watching that. So it kind of gets them involved in, because we're talking about competition, it gets their adrenaline flowing slightly. Absolutely. At least.
Well, a lot of these professional teams have got psychologists or psychiatrists on board. So they're there to help motivate and build, but they're also there now during this period to help with the crisis. And so they've built a rapport, a relationship with the team, and reaching out to them may be much easier. It's the teams or the people, professionals who don't have that opportunity to reach out.
Okay.
Something for me to think about when I become a professional curler next year.
I'm
going to represent Malaysia in Winter Olympics. Curling.
You're going to curl their hair or something.
Phil's not stopping today. My God, he's on a high. He's just going on. My goodness. Wow.
New signing Curly from LITE.
You never know.
Hey, how do you curl for a football team? Imagine, make a way for the ball to go in.
Curl it like Beckham.
Okay. All right. This next article is taken from Bloomberg, and it's about the U.S. mental health care system. Just like its medical health care system, the mental health care system in the U.S. has been overwhelmed, and there's not enough therapists to go around. Just wondering if it is the case here in Malaysia as well. Do we have enough therapists here to help combat the after effects of COVID-19 and the MCO?
Yeah, so I think the key word here is the after effects. And so we're not actually seeing the rise right now, but we're anticipating a huge rise in mental health issues. And this will be maybe primarily among healthcare workers and patients, especially with PTSD, and then depression and anxiety or adjustment disorders in the general public as well. We actually know that the virus also affects the brain and the immune system of people. So we've seen this in other infections, like even dengue and SARS before, and there can be a post-infection fatigue or depression as well. So the sad story is, I think in Malaysia, we're truly short of mental health professionals. And when these numbers rise, I don't think we're going to be completely prepared to cope. But I'm involved in training GPs, and I think primary care needs to step up a notch. They need to be involved in recognizing, assessing, and managing some of these conditions. And in fact, this evening, I'm actually talking to a group of GPs on the common mental health conditions during COVID. So this, of course, can help reduce the stigma and taboo that prevents people from seeing mental health professionals. They can actually find this help at primary care, and that will definitely help to fill the gap.
This article also touched on this thing called adjustment disorder, which you have mentioned earlier as well. Can you tell us more about the symptoms of this disorder, and also, can we by ourselves overcome this disorder on our own? Yeah,
so adjustment disorder is a syndrome. That means it's a collection of symptoms that occur due to a stressful event, such as divorce, illness, moving to a new place, family problems, or financial problems. Uh, so it can present with anxiety symptoms or depressive symptoms, or even a combination of both. But the difference is it's not as severe as major depression or anxiety disorder, and there is a stressor. That means there's a triggering event. It's actually an unhealthy and excessive response to this event, and it can change the individual's life, especially their occupational and social functioning. But like you said,
Is paranoia included in that as well?
no, not necessarily.
Okay.
Yeah. So,
all right.
yeah. But usually with adjustment disorder, it's usually self-limiting. So it can get better on its own if the stress event comes down, and you have better support and you're able to cope, and you make lifestyle changes, or you even start therapy. Medications may play a very small role. Only very few individuals may require medication, but usually, it gets better on its own. It often occurs within 3 months of the onset of the event. So, we're still in this whole period. We might only see the increase in adjustment disorder, in the months to come. Yeah. So, but usually it does not persist for longer than 6 months.
Okay. So when you mean adjustment disorder, does it mean that people just can't seem to adjust to the new normal after after a stressful event?
Exactly. Yeah.
Okay. All right. Final one. It's all about millennials. Our final article is about millennials. They're seeing that their mental health is declining at a much faster rate compared to the Gen X as they age. Now, behavioral health is a key factor. There's a rise in depression rates, financial burdens by the millennials, affecting their mental health as well. So as generation progress, the cost of living has increased, which some consider like a norm, right? As we progress, cost of living will increase. So why does financial status affect the mental health of the millennials more than the previous generations? Generation X, Generation Y. Are they more entitled? Or what is the what is the problem here?
Well, I think it's a multitude of factors. It's not just one. So it's not just their personality or their financial, challenges. But it's true. They may have traits such as entitlement and narcissism, and that's largely related to, the size of families becoming smaller. They're more nuclear. There's, more what do you call parents who give in more often, and so entitlement becomes a norm. It becomes learned through childhood. But also there are other factors like they tend to be social connected via social media much more than others, and they're more in tune with mental health issues. So they're more global. In Malaysia, there's a huge amount of prejudice and taboo and stigma about mental health, and so people don't talk about it. But when you're in social media and you're with the world, it's it's expressed and discussed, and people realize about their own mental health much better than the senior generations.
Yeah.
And so they seek help at an earlier stage as well. And so and of course, I think they also are more health conscious, and it's not for them just the absence of disease. They're more into wellness and diet, and their gym memberships,
work-life balance.
That's a huge thing for millennials, and I think they're showing us the way to go.
But it's healthy, right? Having all these things. Yeah. So it's not so much that they have more mental health issues, it's that probably they're more aware of it, getting it treated much earlier, and therefore having the larger number
softer.
Softer. So in your generation, JD, your people have to rough it out, right?
No,
But
I was just about to ask Dr. Phil about this because
Yeah,
technically Gen Xers like me and slightly older ones, right?
yeah,
We are generally the parents of millennials. Was it
yeah.
because we worked so hard that we gave our kids too much that they
Mhm.
became soft and then they can't handle how tough the world can be? And then when something like COVID comes around,
Mm.
it just affects them so badly.
Well, actually, the question is, are we really that resilient? I mean, with the Gen Y or the millennials, they seem to be able to cope or manage their health issues a lot better than the other generations, and that's because they're more in tune with it, and they are aware of certain things that may trigger it as well. But for a lot of us, we hide this all behind a shroud. Our hypertension and our diabetes, all of that was linked to stress, and we didn't even care about it.
Yeah,
We just
that's
pretend it
true.
didn't exist.
yeah.
Yeah, because we're
So,
men. We can
Yeah.
handle this.
Yeah, but doctor, is
that's a
there a
gender thing.
way
That's
that we can actually encourage millennials? Because a lot of times
yeah,
they get criticized, especially by
yeah,
older generation folks like JD here, for
yeah,
not working, for not being able to be pushed
yeah,
or to work hard,
yeah,
So is
yeah,
there a way that we can actually encourage all these younger people to work
yeah,
hard like the previous
yeah.
generation in order
Wait,
to
before
not
I'm not
only
saying all of them. I'm saying a
yeah,
lot of them. I
yeah,
know a
Love
lot of
them.
not
millennials
Yeah,
who
only
work
yeah,
hard.
not only in financial independence but also I guess
yeah,
in terms of their well-being.
yeah.
Yeah.
Well, again, I don't think it's across the board, but I think for many millennials, early employment is really not about loyalty and commitment. It's very often a means to earn and have fun in their free time, building that work-life balance. And I think we need to look to them to say, well, maybe we shouldn't, embrace this ourselves, because it's actually very helpful for mental health and for physical health as well. So it may be that workplaces need to adapt to millennials and look at work policies that can adapt to, working remotely or from the home like we're doing now. I mean, everyone's forced to do it, but did, you know, baby boomers ever think this will happen? I mean, you have to be in the office at 8 o'clock, clock in and clock out at 5. Anything else is, thought to be, disrespect. But now we're working from home and, having tea breaks when and when we like, So yeah, things like that. And of course, corporate transparency, that's a huge big point in millennials. And, also changes in their lifestyle, like car sharing and house sharing. And, these things may actually be the new norms. And so I think all generations need to learn from each other and not just stick by one that, this is the highway or the no way sort of thing.
So you're saying maybe the way that we've been doing things has been the wrong way, and how they're doing things is actually the right way, and we just can't handle how we were because we did it so wrongly?
Absolutely. I mean, there's perhaps something to reflect
Nah,
on.
No,
I'm quite happy the way I've been.
I think what Dr. Phillip meant was that we shouldn't just condemn them for being millennial.
Yeah.
No,
No, I get it.
we should learn the
Yeah.
good stuff from what they're doing
Yeah.
or what they're adopting
Yeah.
in their lives, and apply that into our own lives.
Yeah. But
It's true. I mean, yeah.
it is true that maybe resilience is not as great as maybe senior generations. And I think that's something that needs to be addressed. And, so what's the harm in actually having mandatory stress management classes in school and, exams that test you on your life skills and, coping with managing difficulties and challenges, So
When you speak about resilience, right, Dr. Phillip, let's say you have an adult child who's like 20, 21 years old, not working, still living at home. To train his resilience, do you just kick him out of home? Is that the way to show?
I'm sorry, I agree with
love?
that statement.
Well, you see, we have a new definition for youth now. They're the biggest consumers, and all our advertisements, if you notice, focus on youth. You know, you got young people in advertisements. You can get some geriatric person walking around and, you know, advertising a Gucci shirt or something, right? You get young people, right?
Yep.
And that's because the youth now is from puberty till 25, 30. They stay at home till about that age. They do the undergraduate, then they do their postgraduate. It's too expensive to stay outside, so they stay at home, get their clothes washed by their mom, and, you know, maybe get a allowance right till the age of 20 something. And, you know, so yeah,
That sounds kind of good though.
Now you
Go
want
back
in,
in time,
right?
huh?
Now you want in.
Yeah.
Yeah, I was just born in the wrong era.
That's right.
So
Yeah.
is that the best way to teach resilience? To just kick them out of the home? Show them some tough love?
Yeah, we need to have boundaries.
Mm.
And, you know, those boundaries need to be set, you know, together in discussion with our own children, and tell them that, you know, look, at this age is when we expect, you know, you to be independent, you're going to be working, you're going to be contributing. And if you're not, then look, it's tough. You know, you have to find a way to do that. Otherwise, you know, you have to be doing it on your own.